that was about the external ear. Now let us shift medial from external ear to this cavity that known as middle ear, or we call it sometimes tympanic cavity. You can say middle ear and you can say tympanic cavity. Middle ear is most common, I think, but anyway, you have to know both, because this room connected anteriorly and posteriorly. It has two doors. The anterior door connected with the nasopharynx. So this tube, we call it pharyngotympanic tube because it connects the nasopharynx with the tympanic cavity. That's why it's called tympanic cavity, right? Also called the pharyngotympanic tube, called Eustachian tube or pharyngeal tube. Anyway, indeed, the what's the nature of the middle ear? So it's a cavity, it's a structure. It's like a cavity, as you see here. It's like a room lined by mucous membrane and usually filled with air. So it's air-filled cavity located in the vitreous part of temporal bone. You have to see on your atlas the vitreous part of temporal bone, right? So what's in there? Yes, there are a couple of structures. Mainly you have the auditory ossicles, the smallest bones in your body. 1, 2, 3, malleus, incus, medius, incus, and stapes, that they transmit, of course, the vibration from the tympanic membrane or the eardrum into the inner ear, because you know here is the inner ear. So the vibrations come, vibrates the tympanic membrane, transmitted through these bones to the inner ear, the site for, of course, hearing. Okay. Yes, in the tympanic cavity or in the middle ear, what you see here communicates, as I mentioned, anteriorly and posteriorly. So anteriorly, this cavity, the middle ear, communicates with the nasopharynx, as you see here, and that this is the anterior opening, right, through, of course, the pharyngotympanic tube, or as I mentioned, auditory tube. Now, posteriorly, it communicates with the mastoid antrum, with the mastoid air cells from here, right? So there's an opening and there is a mastoid air cells here in the mastoid process. So it communicates with it. So it has anterior door and posterior door. Yes, as I mentioned that the middle ear is like a room. And the room has, of course, a roof and floor. And of course, other than the roof and floor, you have 4 walls, anterior and posterior, medial and lateral. Where is the lateral? The lateral should close this, but already I remove it. Already, of course, the author removed it, the author of this of the textbook. Anyway, so the lateral wall should be here, the tympanic membrane, the eardrum, but it's removed to get the look to inside. To understand this figure, I would show you this again. You are removing the eardrum, right? And you have a look here into the middle ear. So this is the middle ear, which is like a box, right? It's like a room, right? So now this is the lateral wall of this room. We removed it, the eardrum. And this is, if this is the lateral room, of course, this is the medial one, this one. That's in your face. While this is the roof and this is the floor. This is the roof and this is the floor. This is the roof and this is the floor. Okay. And you have the anterior, anterior wall. You have the anterior wall and you have the posterior wall. This is the anterior wall and this is the posterior wall. Now, and of course in the middle ear there is ossicles, bones, 3 bones. They are here but also removed. So there are no bones here already removed. To understand what's going on, we will talk about them. Now, let us start with the roof and floor of the middle ear. Okay, here is the auricle, external acoustic meatus, eardrum. Yes, and this is the middle ear. So, the floor of the middle ear of this cavity formed by this plate, in which this thin plate separates the middle ear from the internal jugular vein, right? Internal jugular vein. And if there is infection sometime in the middle ear, it can cause internal jugular vein thrombosis, right? Because it's just separated by a thin plate of bone. This is the floor of the middle ear, right? But what about the roof? This is the roof. This is the roof of the middle ear, formed also by a thin plate of bone, similar to the floor, but it separates the middle ear not from internal jugular. No, it separates the middle ear from the temporal lobe of the brain. Here is temporal, located the temporal lobe of your brain, right? So that's interesting. So we finished the roof and floor. Look at the floor, the internal jugular vein related to it. That's, you see here. Okay. Now let us start with walls. So the anterior wall, but before the anterior wall, can you understand which kind of view you are looking to? This is the eardrum, right? This is the mastoid process behind your ear. This is the auricle should be in the screen. Now you are watching the video on the other side of the screen. Inside the screen, there is an auricle here, right? There is an auricle here on the other side of the screen. And that's laterally, right? So this is medially. You are looking medially. That means you are looking from here. But the internal ear and these structures removed, right? So you're looking from here, so you can see the internal surface of eardrum, right? So it's like moving this, it's like moving it like this, right? So erase these things. So again, you are looking from the you remove the internal ear and you are looking to the from medially, I mean. So this is again the middle ear. So we finished the floor and of course the roof, and of course now we'll start with the anterior wall. That's here, anterior. You remember that the pharyngeal-tympanic tube, or we call the auditory tube, is located anteriorly. That's fine. Leave it for now. There is another opening also for a muscle, but the anterior wall, let us start from here. The anterior wall formed below by a thin bony plate that you see here. Okay, so the anterior wall also formed by a thin plate of bone that separates the middle ear from what? From internal carotid artery. So we mentioned that the roof separated from temporal lobe of brain, while the floor separates the middle ear from internal jugular vein, while the anterior wall separated the middle ear from internal carotid artery. Also, in the anterior wall, you have an opening, as I mentioned, for tympanic tube, and another opening above it for a muscle called tensor tympani muscle. From its name, we will talk about it, but from its name, it's for tension. It will tense the tympanic membrane, the eardrum. So it inserted in the handle of malleus that attached to the eardrum or tympanic membrane, I mean. Here is the muscle, right? Okay. Now we finished the anterior wall. That, of course, this is the middle ear that's separated from anteriorly by a thin plate of bone separated from the internal carotid artery, and you got two openings, one for the largest one for pharyngotympanic tube and upper one for a muscle called tensor tympani muscle. Okay, we finished that. Now let us move on the opposite side to the posterior wall. The posterior wall is very simple. It has an opening here called adductus to mastoid antrum. What does it mean? It's an opening for the mastoid process. Here is the mastoid process you see here in this figure. So there's an opening to the mastoid process. It's called addutus to mastoid antrum, right? Ultimately to the mastoid air cells. And you have a small pyramid that's a pony projection, like a pyramid. We call it a pyramid for the attachment of the smallest muscle in your body. It's called stapedius. It's called stapedius. Let us look here. So this is the cavity of the middle ear, and posteriorly, in the posterior wall of it, because you know this is the anterior wall that contains the pharyngotympanic tube, but posteriorly you have the addutus to mastoid antrum, right? In which the mastoid process and mastoid air cells, right? And you have this projection, which is the pyramid for the attachment of a small, very small muscle, the smallest muscle in your body, which is the stapedius muscle. So, again, we finished. I like to repeat: floor, roof, right? And we finished the anterior. We finished the anterior wall, and the posterior wall are against each other, right? And still, what we have? Still, we have the lateral wall of middle ear, and if this is the lateral, that means this is the medial wall. By this way, we got this room, middle ear. Let us start with the lateral wall. The lateral wall is the easier one and the most interesting one. Why? Because it's composed largely by the tympanic membrane. Tympanic membrane, it is the eardrum, طبلة الأذن. It's largely, yes, as I mentioned. Now, interestingly, the eardrum or the tympanic membrane, it's not directed laterally like that, 90-degree upside down. No, it's a little bit facing downward and forward and laterally. Yes, it's faced laterally, it's very clear, but it's like facing a little bit the ground. If you see, it's not like that, right? Or it's not, sorry, it's not like that. No, it's directed downward, forward, and a little bit and laterally, of course. Now, interestingly, the eardrum is extremely sensitive to pain because it's innervated from inside and from outside. And the innervation of eardrum is very important. This is number one. Now, how can I remember the innervation of eardrum? Very simple. You remember the external acoustic meatus that's innervated by auriculotemporal nerve and vagus nerve, and minor participation from facial nerve. So the same, the lateral surface of the outer surface of tympanic membrane innervates or innervated by the same nerves, auriculotemporal and vagus, right? While the inner surface innervated by cranial nerve number 9, which is the glossopharyngeal nerve. Glossopharyngeal nerve. There's a branch called tympanic branch for the tympanic membrane, of course, right? So it's important. Now, what's also the tympanic membrane is a very important structure, right? So I like it. And interestingly, as I mentioned, I didn't mention that, and now I will say that the tympanic membrane it's concave laterally. That means when you look at it from lateral side, that means, let us get back. If you have a look from here, it's concaved, right? It's concaved membrane or structure, right? In which this concavity made by, let me show you here. Yes, it's concave. Look at the malleus. The malleus, المطرقة, has a handle, this handle. The handle of the malleus attached to the inner surface of tympanic membrane, and it pulls it inward, right? So by this way, the tympanic membrane, I don't know if it's clear for you, it's like concave like that because of the handle of the malleus here. And the most depressive point, it's like depressed, right? There is a concavity. The deepest concavity, the deepest point of concavity is here at the tip of the malleus. We call it ample. We call it ample. So this is, you look into the lateral surface using otoscope into the patient's ear, and you got this preview in which you see the shadow of the handle of malleus, and the tip of this handle is the most depressive concave point, right? In which it's called ample. This is number one. Number two, you're looking again into the ear, ear of the patient, and you use the otoscope and light. So you will find also in that view this triangular cone of light, which is at 5 o'clock, right? At the position of 5 o'clock, we call it the cone of light. Again, this is real view in which this is the shadow of the malleus, and this is the top of the handle of the malleus, in which this is the most deepest part. We call it the ample, and you see here is the cone of light, which is at the 5 o'clock location. Now, because of the it's of course surrounded by fibroclastic membrane, and because of the handle of the malleus here that tightens the tympanic membrane. So most of the tympanic membrane is tight. So this part we call it pars tensa. Pars tensa. While this small flaccid part we call it pars flaccida, right? So this is the pars flaccida, and this is the half is pars tensa. So we are describing, the tympanic membrane. Okay, now lastly, the medial wall. Lastly, the medial wall of the middle ear. Again, this is, let me remind you, the middle ear with the roof, floor, anterior and posterior, and the lateral wall. Still we have this medial wall. Now look at the medial wall. Look at this bony structure here. There is a bulge here. You see this bulge? This bulge creates by the basal turn of the cochlea. This is the cochlea, which is like Snell, right? So the first or basal turn, it creates this structure which is called promontory. Above the promontory there is opening, oval opening, and below it there is a round opening or round window. Oval window, a round window. Also, let me pay your attention to the nerves there from internal acoustic opening or meatus. You have facial nerve and vestibulocochlear nerve. Look at the facial nerve that penetrates, of course, the vitreotemporal bone and passes to the middle ear. This is the middle ear, right? So it passes to the middle ear and it creates a kind of a prominence here. Let me erase this. You see this prominence here in the middle ear. This is the middle ear, right? This is the middle ear. There's a prominence here, which is the prominence for facial nerve, and there is above it there is a prominence for lateral semicircular canal. We'll talk about it in the middle, in the inner ear. Back to the wall. So this is again the last wall, which is the medial wall, and I think I showed you this bulge, which is the promontory, which is created by the basal turn or the initial part of the cochlea. And of course there is a nerve plexus on it called tympanic nerve plexus. But as I mentioned, above this promontory there is an oval window, and below it there is a round window, right? So what else? Yes, we remember the facial nerve that comes and passes through the upper part of the middle ear, and the middle ear, and creates like a prominence, covered of course, but it creates a prominence, and above it there is another prominence for the lateral semicircular canal. We'll talk about it. Okay. Remember the upper one, which is the oval window, and the lower one is the round window. We call it also the oval window, we call it finstra vestibuli, and the lower one, the round one, called finstra cochlea. Before jumping to the talking about the ossicles, I would like to talk to you about the very important tube, which is that known as pharyngotympanic tube that exists in the anterior wall of the middle ear, and also it's known as eustachian tube. So this is the eustachian tube, or we call it pharyngotympanic tube, or we call it auditory tube. Anyway, the eustachian tube extends from, as you see here, from the middle ear, or here, let us say, from the middle ear to the nasopharynx, which is very important, and that means it permits the air to get in and also leave the middle ear cavity. So it's a connection between nasopharynx and the middle ear. So what's the significance of this, let us say, tube? Indeed, let me take this one. You know that the pressure outside on each, we need the pressure of the air on each side of the eardrum of the tympanic membrane to be equalized in order for tympanic membrane to work properly. And so you have the air pressure from here laterally, and in order to make it like equal on both sides of the tympanic membrane, we need air pressure to get in from the inside from here, and this achieved through this very important tube, eustachian tube, in which it connected to the nasopharynx, and the air comes from there and getting from the tube to the internal surface of the ear drum or tympanic membrane. So what you need to know about this the tube, that's about, in adults it's about 40 millimeter in length, and the eustachian tube directed, as you see here in adult, for example, downward, forward, and medially, although in infants it's a little bit horizontal. What's the significance of that? It makes it, it's not just horizontal, but also it's short, that permits the spread of bacteria and infection from the nasopharynx to the middle ear, and most of the time, especially in infants and children, it causes it's the source for the infection that ultimately lead to otitis media, or the inflammation of the middle ear. Now, if you look to the canal, and I would remind you with the external acoustic meatus, you remember the outer third was cartilaginous, while the internal two-thirds is a pony. Now, this pony continues with the pharyngotympanic tube, in which the posterior one-third is a pony, which is a continuation for the external acoustic meatus. Let us say that, and which is the easier way to remember it, while the anterior two-third, as you see here, is cartilaginous, and the border between the pony part and cartilaginous part known as isthmus, which is the narrowest part. Yes, we explained that the auditory tube or eustachian tube is the source of infection from nasopharynx to the middle ear and causing otitis media. So as you see from the previous slides, that the middle ear contains three bones, three small bones. We call them auditory ossicles, the smallest bones in our body. So they are together, if you extend them about 1 inch, that means 2.5 centimeters. They are the malleus, incus, and stapes, right? The malleus attached, as you see here, by its handle to the eardrum, right? And it also articulates with the incus, and incus articulates with stapes, and stapes is, it's a kind of footplate by its base, closed or fitted to oval window, if you remember, right? So it closes the oval window. So now, what's the function of these kinds of auditory ossicles? Indeed, what they do is they amplify the sound vibrations and waves. When they come and vibrate the eardrum, they also amplify the sound vibration until it reaches the oval window. So the malleus vibrates in the incus, the incus vibrates the stapes, and then the stapes transmits the vibrations into the fluid of the inner ear at the oval window. So you can see, follow these steps all the way until you reach the oval window. Then they vibrate the fluid inside the scala vestibuli. We will talk about it. Now, here is another slide, shows the different structures of each ossicle. So the malleus, which is known as that means hammer, مطرقة يعني. So it has a head, neck, and lateral process and handle. On the other hand, you know that the head of the malleus articulates with the incus by its body, and of course the incus has body, short process and long process. Then the incus at the end with lenticular process articulates with the head of stapes. The stapes, which is like the footplate for the horse's saddle, for like that for the horse's saddle, in which that you put your foot there to jump up over the back of the horse. So it has a head, neck, and anterior limb and posterior limb, and most importantly, it has a base footplate that fits the and closes the oval window as you see here in this figure. So why I'm talking about different structures in the ossicles? Yes, we don't care too much about all of these structures, but there are a couple of important structures. Now, let us define the muscles and where they attach to which structures. I would like to remind you for the most important things here. In the malleus, you have the handle that articulates to the tympanic membrane, and of course, there is a muscle, we'll talk about it, also attached to it to tense it to, at the end, ultimately tense the tympanic membrane. And also, you have the stapes that has head and neck, so take care for the neck that there is a small muscle, stapedius, attached to. This is what I want. So I will start with um, uh, uh, the first muscle, which is the tensor tympani muscle. If you remember, we said that this is the anterior wall of the middle ear. So you are looking to the, let me let you understand what you see. You are looking to the middle ear from inside. That means you remove the inner ear from here, and now you are looking to the middle ear, right? So this is the anterior wall of the middle ear that contains, of course, a thin plate here separated from internal carotid artery and the pharyngotympanic tube. Yes, pharyngotympanic tube that has medial, or let us say posterior bony part and anterior cartilaginous part. So most importantly, you have another opening other than this opening. You have an opening for a muscle, a small muscle called tensor tympani muscle, because it tenses the tympanic membrane. This is the tympanic membrane. How it tenses the tympanic membrane? It first of all, it originates from the pony part and from cartilaginous part of pharyngotympanic tube, eustachian tube, I mean, and it inserted by its tendon to the handle of malleus, as you see here. Here is the attachment, and you know the handle of malleus attached to the medial side of the or to the internal side or medial side of the tympanic membrane. By this way, when tensed, it indeed limits the vibration. For example, there is a vibration or sound waves, loud sound, and so forth. So the tympanic membrane will vibrate strongly. But using this muscle, when it's contracted in that response, it decreases and limits the vibration, right? And because it attached to the handle of malleus, and handle of malleus attached to the tympanic membrane. So this muscle is important, but what also important is to know that innervated by V3, mandibular nerve of trigeminal, mandibular branch of trigeminal nerve, right? That means V3, cranial nerve number 5, which branch? V3. Now, there is another muscle. You have just two muscles in the middle ear, right? You have two muscles. This one anterior in the anterior wall, and there is one opposite it into the posterior wall. This one. You remember the pyramid, from pyramid there is a stapedius muscle, the smallest muscle in your body. So here is the stapedius. From its name, stapedius from stapes. That means it fixes and pulls the stapes to the back. It attached to the neck of stapes, right? So When it's contracted, it prevents the excessive oscillation, right? And dampen that vibration. So dampen, I mean the staves, and of course, ultimately the vibration. So the smallest muscle in your body, but it's innervated by facial nerve. By facial nerve, which is not shown here. You can see a branch of it, but you cannot see it. So I will show you in after a couple of slides, right? So it's innervated by facial nerve, a nerve called nerve stapedius muscle. We covered the middle ear by its floor, roof and floor, anterior wall, posterior wall, medial wall, and lateral wall. And also we mentioned the ossicles. We talked about the ossicles bones there and the two muscles there. Now it's the time to talk lastly about the nerves in the middle ear. And as you see, if you remember, this is the promontory that's created by the basal part of the cochlea. Now you can see a kind of a nerve plexus called tympanic plexus. Tympanic plexus comes from or formed from the tympanic nerve, which is a branch of glossopharyngeal nerve, a cranial nerve number 9, the same nerve that innervates the medial side of the tympanic membrane. The medial side of tympanic membrane. Now, the tympanic nerve, as you see, of course, gets a branch from the internal carotid plexus, as you see, and they form the tympanic plexus. This plexus, of course, supplies the mucosa of the middle ear. Also, it supplies the mastoid cells and the auditory tube, and also not just that, but also it gives a branch. This branch is the lesser petrosal nerve. The lesser petrosal nerve. You remember that the middle ear is located in the petrous part of temporal bone, which is easier to remember. So this branch from tympanic plexus called lesser petrosal nerve that leaves the petrous part of temporal bone and passes on the upper part of the petrous bone until it reaches the foramen oval. Then it leaves the middle cranial fossa through this foramen. Then once it reaches the otic ganglion, the parasympathetic ganglion, it gives its synapses there, and from there fibers moved to the parotid gland. So this secretomotor supply to the parotid gland for secretion. This is the story of lesser petrosal nerve. I think from the figure here also you can see the tympanic branch of glossopharyngeal nerve with a branch from the plexus of internal carotid artery to form tympanic plexus, and there is a lesser petrosal nerve leaves the middle cranial cavity through the anterior wall. We have the facial nerve. Look at the petrous part of temporal bone that contains the internal acoustic meatus, that through which the facial nerve, cranial nerve number 7, and vestibulocochlear nerve also pass from there. Now I would focus on the facial nerve because it passes through the middle ear, as you see, before it exits from there. So the facial nerve passes through the internal acoustic meatus, then passes through this canal that called the facial canal. Then there it creates a kind of a ganglion called geniculate ganglion. Now from the geniculate ganglion, the first very airy first nerve of facial nerve arises from there. So this is the first branch of facial nerve called a greater petrosal nerve, not the lesser petrosal nerve. It's the greater petrosal nerve. We mentioned that the lesser connected to the parotid, right? But the greater petrosal nerve also it leaves the petrous part of temporal bone and passes on the surface of petrous pus in a groove until it reaches the foramen lacerum covered by cartilage. But in its way, there is an internal carotid artery, so it passes below the internal carotid artery and it took a kind of a branch from the petrosal nerve there called deep petrosal nerve to form nerve to pterygoid canal. Anyway, the greater, once it leaves through the foramen lacerum, the greater petrosal nerve, of course, will join the pterygopalatine ganglion, right? That, of course, then postsynaptic fibers or the parasympathetic postsynaptic fibers will give supply to all glands above the oral fissure. For example, if this is the mouth, so above the oral fissure, glands like lacrimal gland, like glands in the nasal cavity. What I want to say that all salivary glands above the level of oral fissure, like here in the nose, in the palate, in the and also the lacrimal glands in the orbit, those innervated by greater petrosal nerve, right? Which is a branch of facial nerve. Now, other than the greater petrosal nerve, then the facial nerve continues like in the just posterior to the stapes. You see, creates a kind of a bulge here, right? Creates like a bulge in the middle ear. Then it passes behind the pyramid. Do you remember this bone, which is the pyramid? This pyramid forms part of the posterior wall of the middle ear, then passes behind it. Once it passes behind it, you remember the pyramid gives, it's the site for attachment of the stapedius muscle. This is the smallest muscle in your body that attached to the head of stape, to the neck of stapes. So this is the stapedius muscle attached to the neck of stapes, innervated by a nerve called nerve to stapedius, which is a branch, the second branch of facial nerve. Now the facial nerve continues down until it leaves through this foramen, which is called stylomastoid foramen. This is the mastoid process, right? This is a mastoid process. So this is stylomastoid foramen. But before it leaves in the mastoid part here, it gives a nerve, the third one, which is the Corda Tympani. The Corda Tympani nerve, let me show you in this here. So as I mentioned before, the greater petrosal nerve, this one, gives parasympathetic supply to lacrimal glands, nasal area, and palatine glands there. That means any salivary gland above and lacrimal gland above the oral fissure, above the palate and nose and so forth, above the oral fissure, right? Like nose, like the palate, like the orbit and so forth. But the Corda Tympani, which is arises here as you see, and let us look here. This is another view, right? Internal view. It passes up behind the incus and malleus. You see, between the incus and malleus. So that's why always prefer to make a rupture if there is a need to rupture the tympanic membrane. It prefers to be in the inferior posterior area. Why? Because it's away from Corda Tympani. Corda Tympani passes there, then it leaves the midlicranial fossa through the pterygotympanic fissure, Then once it leaves, it joins the lingual nerve. Lingual nerve is a branch of mandibular branch of the 3 of trigeminal nerve. Anyway, I will show you now a figure after a while. But now the Corda Tympani, I would use different color. The Corda Tympani, it's responsible for all glands below. This is the oral fissure. This is for me. Okay, is the mouth. So below the oral fissure, all glands below the oral fissure, including those small glands in the floor of oral cavity and submandibular gland and sublingual salivary gland, all these glands, the parasympathetic fiber or the innervation for them comes from the Corda Tympani, right? So above the oral fissure is greater petrosal nerve. Below the oral fissure, all glands, salivary glands, and so forth are by the Corda Tympani. So this is the Corda Tympani, right? Yes, once it leaves the Corda Tympani, as you see here, through the petrotympanic fissure, this is the petrotympanic, because this is tympanic plate and this is the petrospartum membrane, so the petrotympanic plate, then it passes there laterally and joins the lingual nerve, which is a branch from V3, which is the mandibular branch of trigeminal nerve. Then it gives like fiber. That means the Corda Tympani sends parasympathetic fiber through the lingual nerve. That means it uses, the Corda Tympani uses the lingual nerve as a way to reach the sublingual and the different glands, including the sublingual and submandibular gland, to innervate both of them, right? What else? It also carries sensation from the taste sensation from the anterior 2/3 of the tongue, because we know that the lingual nerve reaches the anterior 2/3 of the tongue, and the taste sensation carried through the lingual nerve, but ultimately to the Corda Tympani nerve. Thank you so much, and hope you find value in it. Thanks.